are emergency rooms ready for what's to come? Because the COVID case count just keeps increasing. Saskatchewan now has a total of 193 cases. 9 of them are new, and there's been another death in the province, bringing the total number of fatalities there to 3. There are 871 cases in Alberta. 117 of them are new. That big jump due to a backlog of tests that have now been processed. The death toll stands at 11, which is up from 2 from yesterday. And one of those deaths includes a man in his 80s from northern Alberta, the other taking place at a care home here in Calgary. In fact, there are now outbreaks in 4 Alberta care homes. Nancy Carlson is the host of CBC Edmonton News at 6. She was following today's latest COVID briefing. And Nancy, hearing the Chief Medical Officer of Health using that term, outbreak, it's quite alarming, isn't it?
Yeah, you know, Rob, it really does highlight how serious the situation is at each of these centers. Dr. Dina Hinshaw says it's actually her greatest concern, the health of people in continuing care and in similar settings.
Alberta currently has 41 cases of COVID-19 in continuing care facilities. This includes outbreaks in 4 locations across the province. To date, 35 cases have been confirmed at the Mackenzie Town Long-Term Care Centre. 1 case has been confirmed at Care West Glenmore Park. 1 case has been confirmed at the Father Lacombe Nursing Home, and 4 cases at Shepherd's Care Kensington. Each of these outbreaks needs and has received close attention.
The Mackenzie Town Continuing Care Centre is where the first Albertan died from COVID-19, and now 4 people have passed away there. While Dr. Hinshaw says there have been 35 cases there, the company that runs the centre says 66 residents and staff members have tested positive. Rivera says it is working closely with AHS to protect the health and safety of everyone at the facility, which includes following outbreak protocols and screening. It also says their staff members are working tirelessly to support the residents and to keep each other safe.
Yeah, Nancy, healthcare staff getting a lot of attention right now for good reason, but Jason Kenney wants others to get some recognition as well.
Yeah, Premier Kenney was also at today's news conference, and he touched on that, and he highlighted the role of the trucking industry and the drivers on the road. He says it's thanks to them we are all still able to get groceries and supplies. He's also calling on restaurants to open up their drive-thrus to long-haul drivers so they can walk up and get service since the counters inside are closed. He also highlighted that many rest stops have reopened their washrooms and other facilities. Alberta Transport had closed most of its rest stops because people were raiding supplies. Well, the Premier had this message for them.
Early on in the pandemic, we saw people going in multiple times a day raiding the sanitary supplies in those washrooms. So I ask people, please show some basic decency and some basic consideration. Don't do stupid things like that just make life harder for our truckers to keep us supplied all across Alberta society.
And Rob, on Friday, the Premier says the Minister of Transportation is expected to relax the rules for the trucking industry. And he didn't go into much detail on it, but he did say public safety on the roads will be maintained.
Nancy Carlson in Edmonton. Thanks, Nancy. A Calgary woman is terrified about what's happening inside the Mackenzie Town Continuing Care Centre. Her father, uncle, and aunt are all living there and have all tested positive.
It's like a living nightmare, honestly. We've had very little contact with our parents, my cousins and I. We're very concerned about them. All 3 of my family members have really complex medical issues, and we don't know if they're going to make it out of this, and we just want them to know that we love them and that we care about them and that we're thinking about them and we're fighting hard to have contact with them. If one of our parents doesn't survive this and we haven't had a chance to talk to them, I will never forgive Rivera for that. I think this is a warning call for any other resident, long-term care centers where there's outbreaks. I'm telling people who have family members in other homes, pay attention to this because, this is really bad. This has been a nightmare for our family.
Meanwhile, in Saskatchewan, there are 0 confirmed cases of COVID-19 within care homes, but the mayor of Saskatoon has concerns about other vulnerable people. Sam McKeag is the host of CBC Saskatchewan News at 6. She is in Regina. So Sam, what's the mayor pushing for here?
Well, Mayor Charlie Clark has been talking all week about support for people who may be without stable housing. Yesterday, we told you about how Saskatchewan's Ministry of Social Services is increasing funding for emergency shelters and covering the costs of hotels when necessary. But Mayor Clark has written a letter to the Premier saying that's not enough.
I've been in touch with frontline agencies, and they have reported that we have multiple people who've been showing up to community service hubs with COVID-like symptoms. And right now, there is not a clear testing mechanism, and there's no clear processes for how to ensure they can be provided a safe place to shelter and the right services in place to keep them off the streets or from overwhelming the health system.
To get tested for COVID-19 in Saskatchewan, people still require a referral, whether that's from 811, your own doctor, or a public health communicable disease control office.
And Sam, you have some details tonight about some pretty eye-opening pictures people may have seen circulating on social media.
Yes, photos of the cafeteria at the Regina General Hospital have been all over Facebook and Twitter since last week. A spokesperson for the Saskatchewan Health Authority has confirmed these photos are real. However, this is not a secondary emergency room or triage area. The cafeteria is being used as a temporary storage space. The health authority says what you see is a shipment of new, never-used beds that were ordered March 16th and arrived much earlier than expected. They are part of the pandemic response, and we are told they'll be allocated as necessary. Also, the health authority continues to stress it really is counting on the public to help stave off worst-case pandemic scenarios with physical distancing. Rob?
Sam McKeag in Regina. Thank you, Sam. So what is the state of preparedness in emergency rooms right now? Will ERs be able to handle the waves of COVID-carrying patients expected in the weeks ahead? Dr. Neil Collins is handling the pandemic response for ER departments in the Calgary zone. Dr. Collins, are you already seeing an uptick in COVID patients in ERs?
Oh yeah, Rob. We've seen for the past couple of weeks patients coming in both with concern that they might have COVID and minimal symptoms, and now in the past week or so, we're starting to see some patients who are seriously ill with COVID, as well as a lot of people with minor symptoms as well.
And do you have any idea what's coming your way in terms of volume?
Well, there's a lot of smarter people than me working on projections for the volume of patients, Rob. It could be, it could occur in numbers that will certainly test our capacity. Our current projections depend on a lot of factors that are still being worked out, but we're certainly preparing for an increase in the number of patients in the coming months, but especially starting to ramp up in the next few weeks.
And is that pretty much the case in all ERs across Canada? Is that your understanding? They're all bracing for this wave?
You know, it's remarkably similar. We've been sharing experiences with ER leaders throughout Canada, in fact, the world. As you know, several countries went ahead of us in the response to this or experienced this outbreak before us. We've been corresponding with physicians in Italy and England and Switzerland, looking at their experiences, and also the Canadian experience. Eastern Canada is a little bit ahead of us in the number of cases, but the processes, the challenges that we face are remarkably similar across our country.
So given what you're hearing from other jurisdictions, what are you doing to prepare for what's coming?
Well, we've expanded the capacity of the hospital to manage the increase in inpatients that we're anticipating. We've expanded the capacity of the critical care units. You may have heard of concerns over ventilator shortages. We've established practices to use those efficiently and increase the number of spaces we have for critical care. And then we've also expanded the emergency departments in terms of their geographic footprint, the number of assessment spaces. And then we've tried to offload the hospitals. We've canceled surgical procedures, or the AHS canceled non-urgent surgical procedures. as well as many other outpatient clinics in an effort to free up inpatient space. So they've done quite a bit to ensure that we're prepared for the increase in the number of patients that will be coming our way.
So how long are you preparing the ERs to be operating under all of these conditions? Are you talking weeks or months, longer?
Rob, I think the projections right now are for months. The changes that we made to the emergency department right now are very sustainable. I wanted to make the point that we are capable of managing non-infectious complication or emergency department presentations as well. So certainly, if your viewers have concerns that way, the emergency departments are still functioning well within their capacity right now. But in terms of an answer to your question, we're looking at months for these new processes.
We'll all be thinking of you and your staff and all healthcare workers, for that matter, in the weeks ahead. Dr. Collins, thank you so much for this.
Well, I appreciate you having me on, Rob. Thanks for your interest.
For post-secondary students, the current semester is coming to an end, and for many of them, that means it's time to get going on summer jobs. But the pandemic has dried up many seasonal job opportunities. One political science major at the University of Regina says she's one of many students facing an uphill struggle to find summer work, and they may not qualify for many of those pandemic benefits.
All over Canada, you can go on like social media and see people in the same situation, not knowing if they're going to be hired, if they qualify for EI, because they probably wouldn't if they haven't worked, if you even qualify for the emergency response benefit.
The University of Regina has an emergency response fund that acts as a bursary for students in need. It usually commits its full $90,000 to students each year, and that has already been depleted for this year. These days, it's getting 3 times as many applications per day than usual, and it's asking anyone who can help donate to give at yourgiving.ca/emergency. Big changes are coming to transit service in Calgary starting on Monday. All routes, including bus and C train, will have reduced service, but no routes are being cut. The city says ridership has plummeted by up to 80% because of the pandemic, so the decision had to be made. There is some relief for riders who have low income or senior travel passes. The March passes are now good through to May.
One of the challenges is that we're losing a lot of money as the city. And that's not my primary concern right now. My primary concern is to make sure that we're okay and that we're looking after people. But we also have to look at the financial aspect of the whole thing. We are losing, early estimates say, between $10 and $15 million a week as your city government.
A major meeting place is opening its doors to Calgarians once again. The Telus Convention Centre has been set up as a temporary shelter for people experiencing homelessness. The province, city, and other partners are funding it. The centre will provide beds and services for as many as 300 people. It's the second overflow shelter that's opened up for clients of the drop-in centre.
Yeah, I mean, I think it's not easy for anybody, let alone for the people who have to just be displaced from the main building. We've been messaging with the clients and helping them understand why this is so important and that it's in their best interests, not just for themselves, but for our staff as well.
There's a bit of good news on the pandemic front. Air pollution has decreased in 4 Canadian cities. Satellite images show the average levels of nitrogen dioxide created by the burning of fossil fuels have plummeted compared to 1 year ago. Here's what Calgary and Edmonton looked like at this time in 2019, and here's what it looks like now. This is due to less vehicle traffic, of course, because hundreds of thousands of Canadians are working from home. Vancouver and Toronto also saw decreases in air pollution. And finally, for us, a Regina woman has set up a special wishing well in her yard in the hopes of inspiring others during this time of physical distancing.
Everybody thinks a penny is a throwaway. And it's not. There's something special about a penny.
This is Wendy Wiest. She's been collecting pennies all of her life, and these days she's putting them to good use in a way that connects people in her community. She's placed clean and sanitized pennies on the ground around that wishing well, and she wants people to use them as they walk through her neighborhood. She says she's been keeping track, and so far 54 people's wishes have come true.